Asthma can cause or aggravate obstructive sleep apnea, airway inflammation. Asthma is characterized by chronic inflammation of the airways, which can lead to airway obstruction. This inflammation can also affect the upper airway, increasing the risk of collapse during sleep, a hallmark of OSA. Bronchoconstriction. Asthma can cause the muscles around the airways to constrict, leading to narrowing of the airways. This narrowing can increase the resistance to airflow, making it harder to breathe, especially during sleep when muscle tone is reduced. Increased mucus production. Asthma can lead to increased production of mucus in the airways, which can further contribute to airway obstruction, particularly during sleep when mucus clearance mechanisms may be less effective. Increased risk of obesity. People with asthma, especially severe asthma, may be at an increased risk of obesity. Obesity is a significant risk factor for OSA. Excess weight can lead to the accumulation of fat around the neck, which can obstruct the airway during sleep, contributing to OSA. Medication side effects. Some medications for asthma, notably corticosteroids, which are used to manage inflammation, have the potential to cause users to gain weight or retain fluid. This adverse effect may either raise the likelihood of obstructive sleep apnea, OSA, or make OSA symptoms worse. Impaired lung function. Asthma can lead to decreased lung function, especially if it is not well controlled. Reduced lung function can affect the exchange of oxygen and carbon dioxide, leading to disruptions in sleep patterns and potentially worsening OSA. Sleep disruption. Asthma symptoms, such as coughing, wheezing, and shortness of breath, can disrupt sleep patterns, leading to fragmented and poor quality sleep. Poor sleep quality is a risk factor for OSA and can contribute to its development or worsening. Shared risk factors. Asthma and OSA share some common risk factors, such as obesity, allergies, and a family history of respiratory conditions. These shared risk factors can increase the likelihood of both conditions occurring together. Inflammation and oxidative stress. Asthma is linked to chronic inflammation and oxidative stress, both of which have the potential to disrupt the function of the muscles that make up the upper airway and contribute to the collapse of the airway during sleep, which is a characteristic feature of OSA.